we have all kinds of heroes among us. And among those heroes are those brave, persistent women who battle breast cancer, or those who are currently undergoing treatment for it. In this video, we're going to talk about what a disability examiner looks for in a breast cancer case. I use my three-step process, the docs, the book, and the grid, to talk about how you can get on benefits for breast cancer. If you're ready for this, let's get it started. Female breast cancer is the most commonly diagnosed cancer, surpassing lung cancer, not just in the USA, but worldwide. According to the American Society of Clinical Oncology, over 297,000 women this year alone in 2023 will be diagnosed for the first time with breast cancer. It is by far the number one cancer affecting women and a second leading cause of death for women. Now let's get into my three-step process, which is the docs, the book, and the grid. So without further ado, let's get into the docs. The docs are the medical evidence that the examiner is looking at. They're trying to get this information in from your doctors and then figure out what is happening with your breast cancer. Now, the docs is really talking about what the examiner is looking for in the medical evidence of record, or the MR. As I mentioned before in other videos, there's a difference between symptoms and signs and findings. Symptoms is what you say you have. So you have a lump and you have pain around that lump, or you're experiencing fatigue, or you're experiencing some other kind of symptoms that show that you have something happening. That's what you say you have, and it's still important, but what's going to drive your case always is the signs and findings. Signs are what doctors see, and findings are what tests show. The first thing it should show is what is going on with that particular cancer, what type of cancer it is, what is the primary site or the location of the cancer, where did it start. Also, the stage of the cancer has a lot to do with that, as well as any kind of spread of the cancer, and we'll deal with that in a little bit. Unlike some other impairments, longitudinal evidence is not needed as much. Now, longitudinal evidence is just talking about how things have progressed over time. Usually, you need about 12 months, but for cancers, it's not as necessary because the cancers usually show themselves in a short period of time, or it's not really needed to stretch it out over a long period. If you have the cancer and the doctors can see that usually is enough to establish the evidence of that cancer being in your body. The second thing that the docs should reveal is an operative note. So if you have breast cancer and you have a pathology report or a path report, a biopsy, a fine needle aspiration, in some cases an ultrasound, those are findings. They actually show what is happening, and it is a way to determine what the type of cancer it is, what the extent is, what the primary site of the cancer is, and so on. So in essence, if you have an operative note showing a biopsy, a pathology report, or in a lot of cases, just getting a discharge summary from the hospital will have all that information. That is another piece of evidence that is going to be critical in your case. The next part of the docs that the examiner is going to be looking for is anti-cancer therapy, radiation, chemotherapy. There's some adjuvant therapy. There's different types of therapy that are used to try to control or remove any presence of the cancer cells in your body. Not only is the therapy itself important, but also the response to treatment. So if you've had radiation and chemo and something along those lines, how did it affect your body? What happened as a result of the treatment? Did it have an effect on some other part of your body? So sometimes lymphedema can be an issue. sometimes your fatigue and ability to maintain energy is an issue. So there could be complications from the therapy. And then the last thing that the examiner is looking for is what I call the next chapter. Was it a remission? Was there any progression of the cancer? Was it a recurrent cancer? Or did the cancer persist? So what happened as a result after the treatment? Did the cancer come back? Did it spread more? Did it abate or reduce? So what is really going on as a result of the treatment? Now let's get into the book. And by the book, I'm referring to the Blue Book, or the listing of impairments. And in the Blue Book, in the cancer listings, we're looking at listing 1310. There are 5 sections of 1310. And we're not going to deal with all of them. We're going to deal with the first 3. If you want to look at the last 2, there's a link in the description that shows you exactly where to go to find out the listing of impairments for cancer. Before we get deep into this, I want to define some terms. There's something called carcinoma in situ. Carcinoma in situ is basically pre-invasive cancer. For the purposes of the listings, carcinoma in situ is not a listing level issue. So if you have this situation happening, it's not going to apply to the listings. And the reason why is because carcinoma in situ usually responds to treatment. Without getting high to heavy in the details, what we do know is this: the more localized the breast cancer is, the higher the survival rate is. But the more the cancer has spread in the body, the lower the survival rate is. And we're only talking about newly diagnosed cancer cases. We're not even counting cases in which the cancer has reappeared or spread or grown. Procedures such as an annual mammogram have helped in dramatic ways to detect the cancer in its early stages. Treatment approaches over the years have improved as well. And awareness has increased with Breast Cancer Awareness Month, which is October every year, and charitable organizations such as the Susan G. Komen Race for the Cure or Bike for the Cure. Unfortunately, breast cancer still remains a challenge for many women, especially those over the age of 45, and even more so for Black women over the age of 40. Let's first look at the A criteria. In the A criteria, the examiner is looking for certain things. They're looking for, first, inflammatory breast cancer, which is pretty self-explanatory. It's inflammatory. It's causing some level of pain. Then there's bilateral primary breast cancer, where the cancer is in one breast and it spreads to the other breast. Then there's cancer of any size that directly extends to the chest wall or the skin. So this cancer has enlarged to the point where it's actually involving the skin around the breast or the chest wall. Then there's cancer of any size with metastases extending to the ipsilateral mammary breast nodes, or the mammary nodes on the same side of the body as the actual primary cancer site. Now, you may have heard cancer that spreads through the body. That is the term metastasis. It's the process of cancer spreading through the body, either through the blood, through lymph fluid, or some other kind of body fluid. This term doesn't really deal with cancer that is spread to other organs per se, but metastases is the actual presence of cancer in other parts of the body in general. Now let's look at the B criteria. In the B criteria, we're looking at metastases, spreading of the cancer, where the primary location was the breast. And it has to be metastases to any one of 3 areas. The first area is to the nodes around your clavicle. Now there's nodes on the above and nodes below the clavicle. If there's metastases to any one of those 2 areas, then you'll be an automatic allowance. The next part of that B criteria is metastases to at least 10 of the axillary or lymph nodes around the primary breast tumor area. And then the last part is distant metastases. It could spread to anywhere else in the body, your lungs, your liver, your brain. And if you have metastases where the primary location or the start of the cancer was in the breast, then that'll be enough for an allowance. Then there's the C criteria. And the C criteria is talking about recurrent cancer. Now the listing actually says recurrent carcinoma, and I'm reading this, recurrent carcinoma except local recurrence that remits with anti-cancer therapy. So basically, if there's a local recurrence that can be reduced with therapy, that's one thing. But if it's recurrent and it cannot remit, then that is enough to satisfy the listing requirements. Recurrent cancer is basically the idea that the cancer had been in complete remission, but then it actually resurfaced. So in essence, what we're talking about is if it's recurring, but treatment takes care of the issue, and then it comes back again, and therapy takes care of the issue, that is not listing level recurrent carcinoma. But if it is recurrent and anti-cancer therapy cannot take it away or reduce it, then that will be enough to satisfy the listing. Now, we talked about anti-cancer therapy earlier as it relates to things like chemo or radiation or bone marrow transplant or immunotherapy. But when Social Security talks about anti-cancer therapy being a surgery to remove the cancer, that's what we're talking about. It's not saying that a diagnostic treatment is a surgery. If it's removing the cancer, that would be anti-cancer therapy. But just doing a diagnosis treatment is not enough to satisfy that requirement for anti-cancer therapy. Now let's look at the grid. The grid is talking about the medical vocational or Med-Voc grid. And as I talked about in other videos, the Med-Voc grid is what the examiner uses along with the RFC that the NC has prepared to determine whether you can go back to your past work or if there's other work in the national economy that you can still do with your impairments. So the RFC is the most you can do with your conditions. So the MC prepares that, the examiner looks at your past work, and then they can look at what your function is and whether your function, in most cases physically, will enable you to go back to your past work. If you cannot go back to your past work, then the examiner will look at the Med-Voc grid, and that will direct the decision of whether you are disabled or not disabled. But let me share another example, and this is what I've seen very often. Women who are registered nurses, they do major work, and even in this post-pandemic world, nurses are doing God's work. So let's say you have a 49-year-old nurse, a registered nurse. She is involved in lifting patients and doing a lot of physical work. She is likely in a medium range of exertion, which means she can lift 25 pounds frequently and 50 pounds occasionally. So when we see this medium level of work, it's going to really be telling in her ability to go back to past work with an RFC that's at least a light or even worse, a sedentary level of work. So if she had a light RFC, she could transfer those skills to some other kind of work in the medical field with the same skills and processes and tools, things of that nature. She could transfer to a light level of work. But if it's a sedentary level of work, which is far more restrictive, she'll be an allowance. Well, someone doing the homework is watching this video will probably say, well, she's not 50 years old. She's not 55 years old. How could she be an allowance? She's 49 years old. Well, this is where it gets interesting. Let's say that she is 49 years and 10 months old. The examiner can do a borderline age analysis to see whether what she has going on is enough to give her the higher age category sooner. So instead of waiting until she gets to age 50, the examiner can say, well, she's on the borderline. And since she's on the borderline, these other criteria or these other factors can play into the decision to give her that higher age category. So that's one thing that a lot of people don't know about. That borderline age category can really make a difference in a case, especially if they are on the borderline of age 55. And there you have it. That is how a disability examiner at the DDS looks at breast cancer cases. I want to encourage all of you women who are contemplating applying for disability, for SSDI specifically, if you have breast cancer, if you have the documents to show the severity of your case, to apply, because this is something that is going to make a huge difference in being able to just deal with life and to continue to be the hero that you already are. So we look up to you, we appreciate you, and we embrace you. We see you, and we want you to continue to be with us. That's it for this video. Now don't leave me hanging, because I'm going to see you on the other side.